What's up everyone, this is Kitty Clinical here with another video, and today I'm going to be talking about inferior vena cava filters or IVC filters. This is a hot topic right now. A lot of people disagree with each other. The whole society, medical, is just like, oh, we don't like it, or oh, we like it. They're acceptable for these cases, but not for these cases. There's so much controversy around IVC filters that I had to just look it up and take the time to run through it. So there is an article from the Journal of Clinical Medicine. This was published on January 2022. It is currently September 2023, so we're looking at about a year and a half length. This article details a few recommendations, some general guidelines. So I'm going to walk you through what I find from this article and things that are probably going to be important for you to know. So as far as the positioning of the IVC filter, it's important to ensure the position of the filter. You avoid angulations, tilting, the introduction of a retriever hook into the renal veins. It's advisable to reposition it in the same procedure to guarantee proper placement of the filter and prevent future complications during retrieval. As you know, IVC filters carry risk just as with anything else. There is risks of embolization, of death, etc., etc. Estimated retrieval times. So there's no clear retrieval time established. It is recommended when the IVC filter is no longer necessary, it should be removed as soon as possible. The FDA actually recommends a rough range between 29 and 54 days. How they came up with that range beats me. And then as far as anticoagulation therapy and inferior vena cava filters, if the patient has no contraindications, it should be continued after filter placement, retrieval, or during the indwelling time of the IVC filter. It is not necessary to discontinue the anticoagulation therapy for the retrieval procedure. However, it is advisable to determine a pre-operative assessment of hemostasis before filter retrieval. So they're saying it's not necessary to discontinue, but it's advisable to determine this, to basically, you want to look at the full picture, folks. You don't want to just go around and be so black and white about this, right? They don't recommend hospital admissions just for this. As far as recovery attempts, sometimes the IVC filter, due to positioning, inclination, or organ penetration, cannot be recovered on a first attempt. Additional maneuvers with special techniques are recommended. In the case of a lack of experience, it's recommended to send patients for advanced techniques for retrieval procedures in specialized centers. An IVC filter can always be retrieved. However, it is important to evaluate the risk versus benefit of this procedure. So that kind of segues into the next topic about whether or not IVC filters are good in the first place, whether we should even be doing them. But before I get into that, the last recommendation is for pregnancy, and that there is limited data regarding retrievable IVC filters in patients with high-risk VTE in pregnancy. Complications seem to be higher in pregnant patients with thrombosis and IVC penetration. I also want to direct your attention to an article from the AAFP. This was done not too much longer prior to that other article. This article is 2021, and it's called Venous Thromboembolism Management Guidelines from the American Society of Hematology. And they detail one line under inferior vena cava filters, and the line reads, I quote, "Inferior vena cava filters are not recommended with anticoagulation because they do not reduce PE or mortality and commonly cause adverse effects." So what does that mean? Yes, it's a hot topic. I personally don't recommend IVC filters. There are so many risks to them: device-associated morbidity, embolization, filter fractures, device migration, recurrent DVTs, recurrent PEs, vena cava thrombosis, thrombotic complications, perforation of the vena cava, insertion site thrombosis. There's so many things that can happen. There's so many things that can go wrong with an IVC filter that I've actually talked to other hematologist oncologists. I am not a hematologist oncologist. I am simply a hospitalist, but I know vascular surgeons. I've talked to other doctors, general surgeons out there, and it is a hot topic. We're starting to slowly fashion ourselves away from IVC filters because we're starting to realize more and more that there are complications and that the benefits to an IVC filter do not outweigh the risks. So I'm going to lay these articles out there for you in the description. Please take the time to read them. Tell me what you think. Tell me your thoughts. Feel free to agree to disagree, or if you find this video rubbish and you think that IVC filters are great and that they do so many good things, please let me know in the comments down below. I am more than happy to have these conversations. In fact, I love these conversations. It's about medicine, and we're here to save patients' lives, right? I mean, this is what you sign up for, going to medical school, going through residency. You want to know the truth. You want to know exactly what it is to take the best care for your patients, right? So that's what this is all about. Sorry I made this video last a little longer than it should have. It's a very, very complicated rabbit hole, but I am so glad that you stuck it out with me and watched to the very end. Have a good day, folks. See you later.